back to Good Morning Tobago on Tobago Updates. Viewers, now we are going to be chatting with with someone to speak on an issue that's been part of our headlines nationally lately, and that's of course the loss of 11 babies at the Port of Spain General Hospital. And just to get a perspective, at least from the nursing side of things, I'm going to be joined by Mr. Idi Stuart, and he's the president of the Trinidad and Tobago Registered Nurses Association. So a special good morning and welcome to you, Mr. Stuart.
Pleasant morning to you and your listeners. Thanks for having me.
All right, great. Now, unfortunately, this incident has affected so many people, whether it is the parents themselves, the families themselves of the babies, or just the public in general, who now are very apprehensive about seeking care, especially for women that are pregnant, and just whether or not they will get a good enough service from the nurses, because that's a complaint that we're hearing a lot, that in this whole situation, the nurses that handle the parents did not treat them very well. I mean, from the Nursing Association, what do you have to say about that accusation that's been out there in the public?
Yes, it is indeed a troubling time for the health sector. It's indeed a troubling time for the nursing and midwifery community. No one would want to be afflicted in such pain and turmoil that we could imagine those parents going through and reliving some of these instances. But from the association standpoint, we always have to remind persons that one, nursing personnel, and I would have read a couple articles, and a couple articles I would have read where it came from the perspective of the parent. They were wondering why the nurse was giving them, in quoted words, incorrect information, and that was the genesis of why this alleged hoggish behavior. So that is the only areas I could have pulled from, because from the article, I don't know how factual the article would have been, but the article headline would have spelled out nurses were hoggish. But when you read the article, it spoke to the nurses not giving the family the information that they desired. And really, that is not the remit of the nurse within Trinidad and Tobago, unfortunately. The person who have to give those the diagnosis, those clinical updates, is the doctor. So it was a kind of confusing, and probably it needs just to be cleared up, because we won't want persons to walk away expecting the nurse to give them clinical updates about their babies. That's, again, not the remit of the nurse. In other countries, it's different, but in Trinidad and Tobago, it is quite well known and informed by the nursing personnel. Anytime the relative comes seeking those clinical updates, the most you can tell them, yes, the baby is doing fine, the doctors would give you the further updates, yeah? So that's one dynamic. The second dynamic, we must acknowledge that, yes, we may have nursing personnel who we may not be up to scratch, like every other profession, like in medicine, like in the media, like in police. We may have persons, and it's up to the regulatory bodies to weed out one or two persons who may negatively affect the entire profession, which this definitely has done. When you have these one or two persons within the profession who would have come through the system, come through the nursing schools, get employment, and are reacting in a manner which is not acceptable by the profession and by the relatives, you really need to remove them, retrain them, and then bring them back in. If they're unable to be retrained, then they may have to look for a different profession. So we really hope the regulatory bodies, both in medicine, the medical board, and in nursing, the Nursing Council of Trinidad and Tobago, do what they have to do to make sure these circumstances are dealt with. And we really would want to encourage members of the public to get the names of these one or two persons and report it to the medical board, report it to the nursing council. That is their duty to investigate these claims. Sadly, over the years, the nursing council has not been disciplining nursing personnel. That is something that the association has been lobbying. Both the Ministry of Health, who have 6 persons on that nursing council, the Ministry of Health, the Minister of Health actually picks 6 persons to sit on that nursing council. So both the Ministry of Health and the nursing council, we have spoken about this and tried to get them to do what is their statutory responsibility. So there are many dynamics to this, but the chief issue and from the association standpoint, to prevent this from ever happening again in any institution in Trinidad and Tobago, public or private, we are calling on the government to pass the legislation, which is in excess of 11 years old. Since 2013, the National Health Sector Accreditation Act, we are pleading with them to pass that act and install a National Accreditation Council to oversee all of the healthcare institutions and prevent what transpired on those fateful days in April from ever happening again. Yes? So that is the only way forward for us. Mm-hmm.
Now, I know there's another issue that this all sort of brings to bear, and that is the amount of nurses that we have assigned to the various institutions, and there happens to be a shortfall. And I know that you would have posted just last week that, you know, when the institutions are understaffed, the likelihood of fatalities and mishaps happening is greater. So just give us some context where that is concerned.
It's a direct correlation. So we would not want to hear any single minister, member of parliament making any inferences in this statement, because they are also culpable in this scenario. One does not even need to do an investigation for this. The international data is already there. The data demonstrates if you do not have the required number of nursing staff within any unit, the increased likelihood of negative outcomes increases, the increased likelihood of deaths increases, the increased likelihood of mishaps, errors occurring increases. It's directly correlated. So we and the association and would have made the statement repeatedly. Unfortunately, it has not been heeded over the years, and sadly, we are reaping the whirlwind for that inaction. And as long as we still do not and continue to run our institutions with bare minimum staffing, you would continue to have this scenario. Actually, it is testament to nursing personnel, nursing and midwifery personnel over the years that we have not had many such instances over the years, because all of our areas are extremely short. Again, as you would have indicated, we actually posted the clear disparity in terms of nursing numbers in one particular area, and that is just the start. We're going to be highlighting a number of deficiencies within the healthcare space, and one of those deficiencies we highlighted last week was accident and emergency. Persons may want to know why they are waiting so long in the accident and emergency department. Is because you don't have enough staff, and not having enough staff is twofold. One is just not having the required numbers, the volume of nursing staff within the department. But you also have to take in context, even if you have the nursing numbers, you don't have the specialist nurses within those areas. So you may just have the regular trained registered nurse. So it's two dynamics. One, you have to have the sheer numbers. So if there are supposed to be 18 nursing personnel in an accident in the emergency department to properly and safely deliver care, you must also have those 18 nursing personnel being specialist trained nursing personnel, trauma trained nursing personnel. And unfortunately, we don't have that in Trinidad and Tobago. It is not for nursing personnel not wanting to be trained, but the sheer capacity to train them is not there. And sadly, currently as we speak, there's no training school for NICU nurses, no training school for trauma nurses, dialysis nurses. So we're going to be in a further predicament over the coming weeks and months as we begin to see the pool of nursing personnel begin to shrink through migration out of the profession, retirement, vacation leaves. So you're going to see the situation even getting worse. And I guess we only have ourselves to blame for what transpired. Yeah?
I also want to get into some of the reasons why we seem to have these shortages of nurses even throughout the system, because even in the past when we've posed this question to the authorities, we've been told that, you know, the complement of nurses is there. However, when you go to the institutions, we're constantly faced with shortages of staff, whether nurses are on vacation, they're on sabbatical leave, or whatever the case may be. Why is it that we have not changed the structure of the hiring practices, or what is the best practice for the amount of nurses per institution to make sure that we can have the optimal care available for the public?
Well, it really comes down to political will, and governments will often find better uses for public funds. It is not a sexy topic to say, I have enough nurses, I have hired more nurses. It's not really a sexy topic. You're not going to get much votes on that. But you would get votes if you open a new hospital. Never mind, you can't properly staff that hospital. But that is something you can boast about on a campaign. But let me also say, specifically in Tobago is much better staffed than some of the RHs in Trinidad. So we must identify that they are much better staff. When you walk in to the emergency department in A&E, for instance, they have a much higher complement of staff per patient compared to what we have in Trinidad and Tobago. The next dynamic is there is in Tobago, we still have the situation where nursing are temporarily employed. So why would I want to go into a profession where my job security is not stable? It's best I go into police or fire or teaching, where you get permanent employment. In Tobago, we still have a situation where employment is temporary. But we must acknowledge that the current THA executive has given the assurance they are working to fix that. But to date, it is still that scenario. So you must understand, nursing personnel working for 10 years on temporary employment, when the opportunity comes and presents itself from Australia, New Zealand, England, Canada, USA, Bermuda, when that opportunity comes knocking on the nurse's door, hey, come up to our country. We have a shortage also, and we'll make you permanent. We'll pay you 3 times, 4 times what you can make in Trinidad. We will give you housing accommodation. We'll pay you all a bonus just to resettle in our country. You could understand the choice is very easy. It's difficult in terms of you'll be moving away from your friends and family and into a different environment, but you'll be much more comfortable to be lured away from our shores. So we are doing a very terrible job in Trinidad and Tobago in retaining nursing personnel. Nursing personnel have an option. They can work, and we are some of the nursing personnel in Trinidad and Tobago, some of the best trained. So when they go abroad, they excel easily, and they're actually promoted rapidly in those foreign countries. So they continue to focus, and we speak English, which is another big plus for the Australians, the Englands, the USA. So our nurses are pulled a lot away continuously, and it's a problem that the government has turned a blind eye to. It seems that they are comfortable with the status quo. So I guess instances like the 7 babies dying, even though it's extremely unfortunate and we would not want it to happen again, we are not seeing the institutional structures to prevent something like that happening again. And unfortunately, we may see a recurrence because this has happened before, not in the scale, not in terms of 7 babies dying so suddenly at once over a 3-4 day period, but we have had instances in the past, and reports would have been done, investigations would have been done, research would have been done, and it point to 2 specific areas, a number of areas, but 2 I would mention. One, not enough staffing. It clearly stated not enough patient to staff ratio. Clearly, in a report in 2013, when they did an investigation at San Fernando General Hospital, what led to so many babies dying from bloodborne infections. And then 2,
Leave
it
things
spoke
right
to
there. Yes. I want to thank you so much, Mr. Stuart, but we're going to have to leave things right there because we're out of time for this interview this morning. But I certainly appreciate the information that you shared with us as we try to make sense of what's been going on, especially with the nursing profession in Trinidad and Tobago. So thank you again.
Thanks for having me.
All right, well, viewers, we got to go for a break, but we'll be right back after this. So don't go anywhere.
Go, go. It's a brand new morning.